To be here. Thank you all for being here, for having me here, for being on a panel with such distinguished individuals. But I want to speak to you, and I want you to look at me when I talk. And I'm not saying that from the classroom perspective, but I want you to see me. And I want you to see me as not what people think of as a patient of a community health center. People have myths and preconceived notions and misconceptions about what a patient who's receiving indigent care looks like. So I say that to start off because a lot of times when I talk to people about disparities, people have an image of what that looks like. Well, I didn't think I fit the bill of a patient at a community health center. I was doing well, ready to retire in a couple of years, want to say living large, doing my thing, and had just returned from a fabulous vacation, and I started feeling sick and didn't know what was wrong. I thought because of my age I had overexerted myself on some excursions, so it was like, oh, maybe it's just old age, maybe like, oh goodness, let me put a little bit more Bengay here. But the pandemic, we returned on a Sunday, and the pandemic shut the country down on Tuesday, so medical care was scarce. I'm having to call my doctors, my fabulous doctors that I'd been seeing for years, and do video appointments. So I'm trying to stand up and show them, where the pain is. Well, fast forward, the pain became more intense and it was more aggressive, and I started to not have the ability to walk without assistance. So I was put into the hospital, and after several tests, the fear is there, it's a pandemic, I'm in a hospital. Long story short, I was diagnosed with a bone marrow disease. I had tumors growing inside of my bone marrow and pushing fluid out, so my bones became fragmented, pretty much like crumbled, and it was very aggressive. So I went from a cane to a walker to a wheelchair, all while the pandemic is going on, but I'm still trying to work remotely now. The illness affected my heart and my kidneys, so I had to see a nephrologist and a cardiologist before I could be cleared to have this major surgery that I was going to have. Everything was clear with the nephrologist, went to the cardiologist. Next day, got the diagnosis of I had 2 valve leaks in my heart. So the story gets better. And it sounds like make-believe, and it sounded like make-believe to me as well. So here I am now, I can't walk. I'm not being able to work completely. I'm living in a 2-story home, but now living downstairs because I can't get upstairs. My sister had to move in with me to help care for me, but I'm still working. I then have the surgery on my heart. I'm still working, so I have insurance. So finally get clearance to have this major surgery. So I don't have just artificial bones. I'm full of titanium and fake muscles and fake nerves. So I'm a semi-bionic on one side of my body. So I made it through that. Didn't make it through that yet. 4 days before I was to have that surgery, which was going to be about 6.5 hours, my sister was driving me because I couldn't drive any longer, and we were in a hit-and-run car accident. We were at a stoplight. I looked in the side view mirror. I saw that the woman was on her phone and was not stopping and driving fast. She slammed us underneath one of those monster pickup trucks. So I have burns and lacerations and cuts all on this side of my body. 4 days before I'm to have this surgery. So now I have stitches in my chest from my heart surgery, getting ready to have a half new body given to me. I now have this car accident, but I have insurance, I'm good. I go to the hospital, everything comes out fine. I have the surgery, I'm home for almost 16 weeks of therapy. I had to have in-home therapy for 4 weeks. 4 days of therapy, 1 day of a nurse every day. I'm gonna move it on for you. I get a phone call from my job, and they didn't call to check on me to see how I was doing. They called to say that because of the pandemic, they were going to shut down my position. See, that was perfect timing. That's how I felt. But they were going to end my position. So now I have no insurance, which means I still have to have health care. I have no job, I have no insurance. They gave me a couple of weeks of severance pay. Now I have no money coming in, and I know a lot of people will think again, when they think about indigent care, well, people should save for a rainy day, or they should have a savings. Well, my rainy day turned into a 2-year monsoon. So for everything that went out, nothing came in. So I had to pay for every time a therapist came to my house. I had to pay for every time a nurse came to my house. That was for 4 weeks. I had outpatient therapy for the remainder of those, for 10 weeks, I'm sorry. However long that was, 8 more weeks. I had to pay every single time I went to a doctor. There's nothing coming in. I have a beautiful home that I had to maintain. I have car insurance, I have bills, nothing's coming in. I'm now without a dime. I remember having $5.22 in my checking account. Nothing. And what was I going to do? Here I am not in a position to even know what to do, because this has never happened to me. And I'm quite sure there are several people that you probably see every day that are in the same situation or could be in that situation. I did not know where to go. Like, oh my God, I am now having to get government assistance. How dare I? Oh no, not me. That's for poor people. That's for people not like me. But I had to put my pride aside and say, wait a minute, you have nothing. You have nothing. So I made some phone calls, and someone told me who to call, Hillsborough County, and apply for health care, because I couldn't even afford Obamacare. So I did that, went through the process, and got the paperwork done and completed, and still now, my pride is still here, because you think community health centers, no, you don't even think that, you think clinic. And you think about subpar treatment, or you think about outdated or antiquated equipment. So my insurance was approved, the paperwork was approved, and I finally had to go to my first appointment. I was afraid, I was embarrassed, and it's sad to say, but people have such a negative outlook on community health. I didn't know what to expect. I had no idea. But when I walked in, and this seriously now sounds like the happily ever after, because it was. I was assigned to go to Tampa Family Health Centers. I'm like, okay, I see them on corners. I passed by them, but I didn't have to go there. But I went in, and when I walked in, and they're not paying me to be here, but when I walked in, the facility was amazing. It was amazing. It was state of the art. It was super sterile. From the front desk, everyone there treated me with dignity. They treated me with respect. They treated me with compassion and kindness. And I think about all of the people who have to live like this on a daily basis. This was going to be temporary for me. But when I think about people who don't have health care, who can't afford health care, and are already saddened, or already depressed, or already confused, or already angry, that they have a place like our community health centers that treat them with the respect that they should have. And so I was just amazed at the care I received, the physical care, and because I had already lost almost everything, including my mind, I also sought behavioral health from Tampa Family Health Centers. And again, I'm thinking, well, they're gonna give me an intern who's just learning how to, communicate through human services class or whatever. Those misconceptions again. But this young lady was amazing. As soon as she said, how are you doing? I've lost it. 2 years of struggling, I lost it. And I kept apologizing to her, but I realized that was her job. But I just thank the Tampa Family Health Centers for literally saving my life. They saved my life. I never had to pay one single dime for health care, for doctor's visits, for medicine. And if it had not been for a community health center, I honestly would not be here, sitting here talking to you today.